Welcome back. Canada's aging population is putting new strains on our healthcare system. Some believe that the answer lies in technological, procedural, and cultural innovations. Dr. Kelly Leitch is the chair of the University of Western Ontario's Ivey Centre for Health Innovation and Leadership and the author of a new white paper on healthcare reform. Great to have you here.
Thanks for having me.
What's the kind of central tenet here? Because we operate in a system that does seem to soak up ever-increasing amounts of cash. How do we stop that from happening?
Well, our central focus of our paper is about taking action, and that there's three primary things we need to focus on. One is the development of a knowledge leadership army, really those skilled individuals to work in the healthcare workplace to drive change. The second is to make sure we take manageable projects. There's this tendency to want to be all things to all people. We think manageable chunks of pilots that can then perpetuate where we want to go is the way to start. And lastly, cultural change. Individuals like myself need to adopt these new ideas. We need to internalize them so that we can successfully move the system to new space. You know, if I figure out how to use an electronic patient record, that's a big win. And other surgeons like myself doing the same would be a good thing.
There's a 1,000-pound gorilla in the room that you haven't addressed, so I'm going to bring them in right now.
Okay.
How can you ask for any of these innovations when you talk about productivity or cost cutting or efficiency and leave it in the government's hands? Your paper should start with a chapter that says we must privatize this now. Isn't that the only path to success?
I think we should all be very proud of the Canadian healthcare system. But what we haven't done is looked at new ways to innovate and find efficiencies in that system. You know, by way of example, barcodes. Retailers figured out that barcodes could aid them in making sure that they could create efficiencies for themselves.
Private sector innovation.
Absolutely. Private sector innovation that should be adopted and placed into the healthcare system. A, it would create efficiencies. B, it would probably improve patient safety. So we need to take those great ideas from those other sectors of the economy and place them into the healthcare sector so we can actually drive change and create a more safe environment for our patients. So absolutely, we need to make sure that, those kind of innovations end up in healthcare. Healthcare is in the 1970s now. We need to move it into 2010.
The strongest argument, though, that you'll get for privatization is that it would kickstart a lot of that. It has a way of sort of forcing innovation and leanness and competitive behavior. For people that don't want to privatize their system, that like the single-pay public healthcare system, how do we introduce that? I mean, that seems to be the heart of what you're talking about here, introducing some of the mentalities of private business within the structure of the public system. Has it ever worked anywhere?
I believe it truly can work, and I see that every day, and that's what we're doing at Ivey. We're educating individuals to be those leaders in the system. We have some fabulous CEOs in the system right now, but we need more of them. And we need individuals that understand both the clinical practice side as well as the business side of how a hospital or those other large institutions work. So by being able to marry the two, which is what we attempt to do at Ivey, having that new leadership army of knowledge brokers, I think that we'll be successful in driving change. You know, Banting and Best had a great discovery, but they were also great entrepreneurs. They got it into the marketplace, and insulin saves millions of lives. You know, we need to instill that kind of mindset into our current scientists and clinicians and give them the skill set to be able to apply it. You know, in medical school right now, we don't teach medical school students leadership skills to that extent. We don't teach them how to innovate. We need to do that. And that's what we propose to do at the Ivey School of Business.
Well, that's terrific, because the Ivey School of Business is the best business school in the country.
Hear, hear.
No question about
Kevin
that.
went there.
But however, I want to ask you another question. You talked about the 1970s, where our industry is in healthcare versus getting it to 2010.
Yeah.
Isn't the real root of the problem is because it is controlled by government? And this is what I'm worried about. Your whole industry, your whole sector, even you, do you fear biting the hand that feeds you by not speaking out against this onerous government that is controlling your sector? Does anybody step out in your industry and say, the government control of healthcare is simply wrong and I'm going to change it? Do you worry that they're going to squash you because basically they control you?
I don't agree. You know, I make decisions on the patients that come through the door of my clinic every day based on what their clinical need is. I took a Hippocratic oath, and I follow that. I don't have a government bureaucrat sitting in my clinic regulating what I do or don't do. What we need to do in the system is have leaders that will challenge the current system and introduce innovative ideas and push them along. You know, Jim Collins talks about in his book that giant flywheel where, you know, you start pushing and you push a little harder and eventually it gets some momentum. We need a whole number of leaders in the healthcare system today to take on this challenge of driving innovation into the system so the flywheel becomes perpetual all on its own.
The OECD just put out a report highlighting what a lot of us know: we can't afford our system. They think we need to go from 8% to 4% of expenditures, cutting in half while demographics are pushing us in the other direction. Is that even possible in your view?
It's a huge challenge. You know, I'd have to look at that specific report, but I think it's a huge challenge. We have this, you know, tsunami coming at us on the age side as well as on chronic illness and disease, and all the more reason why we need to be innovative on how we approach these things and introduce those things from other sectors of the economy into healthcare so we can address them.
All right, we'll leave it there, Kelly. Great to have you here.
Thanks for having me.
Dr. Kelly Leitch, chair of the Ivey Center for Health Innovation. Congress will begin hearing next week. We'll begin hearings